Good day, good afternoon for all the viewers who have joined us from different parts of the world. Welcome to the weekly series of Caring Conversations Empowering Lives for Cancer Care. In this series of events, we come together with eminent experts in the field to discuss and empower cancer patients as they fight their battle against this disease. In today's event, we will first discuss a new breakthrough in cancer research that has the potential for diagnosing brain tumor, a type of brain tumor, glioma, early from urine samples. Then we will hear from our distinguished guest, Dr. Sandeep Bhatia, how genomic testing can be a game changer while undergoing cancer treatment. We would encourage you to ask questions to our experts by typing them in the comment section. We will take them up at the end of the session. Let's begin with today's session of Cancer Facts. As most healthcare providers would emphasize, every month that is delayed in cancer treatment and detection can increase the risk of death by around 10%. The often late stage presentation of this disease to the doctor and therefore late diagnosis of the disease continue to hamper therapy options, thereby increasing the chances of metastasis and leading to poor survival of the patients. One example in this case is brain tumor, which is often late for the symptoms to appear, and it is usually detected when the limbs are already paralyzed. But even when they're detected, they are so advanced that it is difficult to remove them by surgery. Among these types of brain tumors, the deadliest are gliomas. These tumors have an average survival time as low as 12 to 18 months. Therefore, for the patient to have a chance of survival, early detection is absolutely necessary. Fortunately, one characteristic of the brain tumor is the presence of cfDNA or cell free DNA. These are small DNA particles which are released by the tumor cells when they die and they dispose of the old damaged tissues. Usually, in the normal cellular routine, these cfDNAs are cleared up by macrophages, which are specialized cells which removes the cell debris. But in case of cancer cells, the cells divide so quickly that there is an excess leftover of cfDNA, which is then excreted to the urine. So when these cfDNAs are present in the urine, there is a chance to detect them. Professor Takao Yasui, who is a member of this Japanese research group, they have used these cfDNA samples in the urine to diagnose brain tumor. He says that the detection of these cells as a non-invasive way to check for cancer has been approved by the US FDA. These are used for cancer screening, diagnosis, prognosis, and monitoring of cancer progression and treatment response. However, a major bottleneck is the lack of techniques to isolate these efficiently from urine. These cfDNAs, as I mentioned earlier, are very short, fragmented, and are present in low concentration in urine. And that is why the techniques that are used to isolate these DNAs are not very much well established. So, to overcome this problem, this research team used a catch and release method on zinc oxide nanowire surfaces to capture the cfDNA and extracellular vesicles from gliomas. By extracting these DNA, they were able to successfully detect a specific type of mutation that can test for glioma. These are called IDH1. This was a very exciting thing for them because this is the first reported detection of IDH1 mutation from urine sample, and even low volume of urine sample as low as 0.5 ml is sufficient to detect this type of mutation. So these type of findings increasingly increase the effectiveness of detection tests from urine. And as people regularly provide their urine samples for various types of biochemical test, if these kind of tests are established, then a early detection method is very much possible. These results were published in the journal Biosciences and Bioelectronics. Hopefully, such advances in cancer early detection would significantly improve the chances of survival for these patients. As we discussed in this case, identification of a key mutation in glioma helps in detection of this cancer type. Like I mentioned, the IDH1 mutation. So these type of genetic alterations are also called as biomarkers or tumor markers, and they serve as guiding factors towards cancer detection or treatment. Each person's cancer has a unique presence of biomarkers. So these biomarkers can be used not only for detecting cancer, but it can also affect how certain treatments may work. Then there are also biomarkers that can help doctors diagnose and monitor cancer during and after treatment, if the cancer treatment was effective or not. Today, we have with us Dr. Sandeep Bhatia, who will shed some more light on the importance of these tumor markers and also why cancer patients should do genomic testing to better their treatment chances. Dr. Sandeep Bhatia is the Vice President, Healthcare Ecosystem at Innoplexis. He is a trained ENT and head and neck surgeon. After his hospital, clinical, and surgical assignments, he joined the pharmaceutical industry, where he has about 18 years of experience, especially in the field of oncology, and headed India Medical Affairs Department for global pharmaceutical companies. He is instrumental in the launch of a immunotherapy drug, Keytruda, in India. Interestingly, Keytruda is effective only for a few cancer types in adults whose tumors express a particular protein, PDL1. So, as I was saying earlier, this again emphasizes the importance of testing for a tumor marker for personalized cancer treatment, for targeted therapy, for immunotherapy, etc. So, welcome, Dr. Bhatia, to our event, and we hope to learn from you a lot today.
Thank you, Tapshi, for a generous introduction. Thanks a lot and for inviting me for this event.
We are so thankful that you could join us today. So, before we go into the depth of this topic, Dr. Bhatia, can you please explain to our audience what is genomic testing and when is it recommended?
Yeah. So before even going to genomic testing, I would like to first touch upon a little bit about what is gene, because it's important to understand the gene before we go to genomic testing. So gene is a slice of DNA which have the codes in it, and these codes makes protein in the body, and this will help the body to function. And genes actually housed around a thread-like structure called chromosome, and these chromosomes are resides in the cells. Overall, it has been found and studied there are 30,000 genes in the human. These all 30,000 genes are called genome. So now we know genome. So when we do a testing of these genome, which we are testing the whole genetic makeup of a person, this is called genomic testing. But there is another term which actually many people hear about is genetic testing. So genetic testing is not exactly the genomic testing. In genomic testing you are testing a whole genome. In genetic testing, we generally test the inherited mutations. So what does this mean? That inherited mutation means the mutations which runs in families. So since now we know what is the difference, it is easy to understand for everybody.
Okay. So, so if I understand correctly, you mean to say that if a person is doing a genetic testing, they can just see what is the risk factor for getting cancer, but they may not have a cancer eventually in their life.
Yeah, which runs in families actually, from parents to their children. So that's what the doctors want to see, whether the child of a infected or a cancer patient is that mutation is getting transferred to the child. So that's how the genetic testing happens, and it helps predict in future about whether a child has a incidence of having a cancer in future and what is that incidence. So then doctors plan more screening around it, so that that person should be screened regularly and managed efficiently in future.
Okay, okay. Then when is genomic testing recommended, doctor?
Genomic testing is actually happened when the patient is actually having a cancer. Now doctor wants to see what type of genetic makeup the cancer has, so doctor recommends a genomic testing for for that patient.
Mhm. Okay. And how would a patient benefit from the genomic testing? You said the doctor, it helps the doctor in identifying what type of cancer, maybe prescribing treatment options.
Yeah. So before that, I would like to first stress upon cancer is not a one disease. Cancer is a multitude of a disease. Every cancer has a specific genetic makeup. Now, it's very important for the physician to understand what that genetic makeup is. In earlier days, there was only chemotherapy or a radiation therapy. So there was not a concept of precision medicine, which doctors now follow. So, and nowadays, if we want to actually follow the precision medicine, it is very important to understand the genetic makeup or a gene change in a cancer, which we call as a mutation. So, what type of mutation a cancer patient is having is very important to understand. So, why it is important? That helps the doctors or a treating oncologist to decide what type of the targeted therapy the patient should be given, because that would help us to actually eliminate the cancer tissue which is linked to that mutation. So that's where the treatment part comes in, which helps the doctors to apply the knowledge of this genomic testing. Now, apart from the treatment, genomic testing also helps to understand whether this cancer can become resistant to some treatment. Why it is important to understand beforehand? Because if we don't know, we will give a treatment without even understanding it. Now, let me give you one example of how it can happen. We have a acute myeloid leukemia. That's one of the disease. 20% of acute myeloid leukemia is actually having a mutation in a IDH gene. Now, IDH is isocitrate dehydrogenase. Now, in some of the genomic testing or the test when we conduct on a patient, we can see that there are certain genes, if they are also being expressed or mutated along with IDH, it may lead to resistance. One of the commonest gene mutations which has been linked to this resistance is IDH1 and IDH2 isoform switching. So this also helps the doctor to understand and pre-plan whether they have to give IDH inhibitors or they have to add a treatment or even start a new treatment. That actually helps the patient in a long run because they would not be then developing a resistance. The third thing is, since now we are actually giving a targeted therapy to a patient, the drug will only act on the tumor having those mutations or on the target. It will not act on the whole body. Earlier in chemo and radiation therapy, the chemotherapy used to kill the healthy cells also, which leads to the more adverse events or the side effects of a chemotherapy. In targeted therapy, we are able to control many of those side effects. But targeted therapies have their own side effects, but that is easily manageable. So these are the three, four important things which we can do after the genomic testing.
Okay. So if I understand you correctly, doctor, so if a patient has to be prescribed targeted therapy, which has lesser side effects than chemotherapy, then
Yes.
the doctor would definitely need the reports from a genomic testing.
Yes, because that would help them to identify the mutations and give the proper therapy.
Okay. So where can a patient get the genomic testing done?
So, if I talk per se about, there are many high-end diagnostic labs which are available, but doctor needs to give a prescription because they understand the need of which type of genomic testing is required for the patients. So, patient can directly go with the prescription to these high-end labs and get the test done, and the reports can come within 2 to 3 weeks or maximum in 4 to 6 weeks of time.
Okay. And is this a normal practice now for a physician to prescribe a genomic testing, or how willing are they to accept this?
Yeah, so it's very nowadays it's a regular thing for a doctor to prescribe or to know the actually targeted mutation, because that's the norm of the treatment now. It's not only chemo; it has to be targeted therapy, and nowadays the immunotherapy has also come, like Keytruda. So doctor wants to get the test done before prescribing it. Of course, there are certain conditions where you don't require genomic testing as such, like a slow growing cancer, which have a definitive cure available, which doesn't require the genomic testing to happen. So that's the doctor to decide how and where they need to get the test done.
Okay. There is a related concept, doctor, that we sometimes come across, which is called as biomarker testing. Is it something different, or these are synonyms of genomic testing itself?
So genomic testing, I said that it's a testing of a whole genome. In biomarker, you try to identify. It's a shorter version of a genomic testing where you are trying to identify a smaller gene sets to see whether these common gene mutations are happening in a particular cancer. In genomic, it's a whole genome that get tested, and then you are able to identify even some of the uncommon mutations in a particular cancer. So that's how it differs. But yes, in biomarker also it's the same thing, but on a smaller set of genes.
Okay. So, as you said, we can identify unknown mutations when we are doing genomic testing. So, that can also eventually help cancer researchers, right? So, if they want to find a new novel treatment based on those mutations, that could advance cancer research as well.
Yeah, that's what is happening nowadays, because there are some of the unknown mutations which is not known for that particular cancer is happening, and if the doctor is able to identify those mutation in different cancer, they can even see how the treatment can be given to these patients. Of course, there are many trials are running which are trying different set of mutation and trying to identify the new targets. So these are the continuous process and it will continue to happen.
Okay. Then patients can participate in these appropriate clinical trials based on the recommendations of the doctor, I'm guessing, because they have that particular genomic mutation, and then maybe they can participate.
Exactly. That's what is happening. And for those patients who actually became resistant to current therapies, this is actually a very good chance for them to get a drug which is under trial. And if they get a response, their prognosis gets improved a lot. So that's a very helpful for the patients who actually develop a resistance to current standard of cares which are available in the market.
Okay. That is a really insightful information. I'm sure because many patients are sometimes becoming resistant to the standard therapies. They are looking for options that are out there which they can try. So this would be a helpful thing to know for them. I'm sure this will bring further clarity on the importance of genomic testing. We have a few questions that I see in the comment section that has come up related to genomic testing, and Dr. Bhatia, if you could help us answer those. So the
Okay.
first question is, what is the cost of a genomic testing in India specifically?
Okay, if I talk about the whole genome sequencing, there are shorter panels also available which are cheaper. But if we are talking about genome testing as a whole, then it hovers around in the different diagnostic labs from 100,000 INR to 200,000 INR. That is 1 lakh
Oh,
to 2 lakh rupees per test
1 lakh. Okay. Okay.
of whole,
And
whole genome sequencing.
yes, and these are mainly available in high-end laboratories, like you mentioned. So,
Yeah.
if a person is in a tier two or tier three cities, then they may need to travel to a tier one city to get this testing done, or
So they
how
have
is it?
their collection centers in many cities now in tier 2, tier 3 towns. So these can be easily done. The patient can be easily approached by these labs.
Okay, and how long does one have to wait for a genomic testing to take? Like, when are the reports available after the testing is done?
The usual time in most of these genomic testing is 2 to 3 weeks. But yes, in some of the cases where we are trying to find more mutations and it takes a little bit more time, around 6 weeks.
Okay, so in the meantime, when this is taking place, when the tests are taking place, do the patient have to wait for the test results to come out, or the treatment can already get started?
But it depends on the patient to patient. If the patient cancer is not progressed, if it is not metastasized, it's a doctor call to decide whether they want to wait. But generally, they start a basic treatment, wait for the genomic testing result to come, and they add or they start a specific treatment as per the mutations.
Okay, so if I may summarize, so this genomic testing comes at a very late stage, not a very late stage, but after some initial diagnosis, confirmation has been done of the cancer, and the patient has been prescribed a treatment. Then the genomic testing may be done so that a better treatment regime or better treatment plan can be devised. Is it correct, doctor?
So generally the doctors, if the patient is willing, the doctors gives the test recommendation at the first go to identify the mutations. So that happens simultaneously. Now, parallelly, if there is a standard of care of a combination treatment, the doctors prescribe certain treatment and wait for 2 weeks to get the reports and start specific treatment. But yes, the treatment starts immediately as per the doctor knowledge and as per the patient condition. The doctor may not like to wait for 3 4 weeks. They want to start a standard of care and then switch on to the whatever the genetic makeup has been identified for that patient.
Okay. And another question from the audience is, can genomic testing be done using blood samples?
Yeah, a new concept has come in the last few years. It's called a liquid biopsy. So liquid biopsy can be done with the blood samples. It actually carries the tumor cells, which has been detached from the main tumor and are circulating in the blood cells. So in liquid biopsies, the labs then test these cells and give their recommendation on the gene mutations.
So these would be like the non-invasive testing that we are talking about. Even earlier, I was mentioning about the cfDNA from urine samples. Maybe
Yes.
you were talking about the same kind of thing.
Yes, it's just like a cfDNA. It's a ctDNA because it's a tumor DNA. So that's what the liquid biopsy test, and it's very commonly available in India nowadays. And it's
Is it
really
available?
yeah, yes, it's available freely in India now.
So is it available for all cancer types or for some few definitive ones only?
So there are debates happening. There are debates happening that it's helpful for particular cancers or certain cancer which the biopsy is you cannot take a biopsy easily. But nowadays, the the precision of these liquid biopsies is also very high. They give a very good results. So a lot of doctors have even shifted to the liquid biopsies.
Okay. Okay. There is another question from our audience. Is there any side effect of genomic testing?
Side effect, I would not say a side effect. Even it is actually doctor gets a better vision of how the cancer will progress, how it will grow, what is the genetic makeup, what treatment is suitable. So I would not call it as a side effect of genomic testing, because the test cannot give a side effect. We are not giving treatment. It's we are doing only testing. Yeah, of course, once we give a targeted therapy after genomic testing, which is relevant for a tumor, there might be side effects of that targeted therapy, but not of a testing.
So this is only a test to determine whether a specific mutation is present.
Yes.
And it is done from, like you said, the biopsy sample itself, or from liquid biopsies using blood, or if some other samples are available for testing to be done.
Yes.
Okay. Any last words, last thoughts from you, Dr. Sandeep Bhatia, on why should patients not fear genomic testing and get it done on doctor's recommendation?
So nowadays biopsy has been done for all the patients. So it's not that the biopsy is being done only for genomic testing. So we should not be fear of that biopsy will be taken. Biopsy is the most important test to diagnose a cancer, whether the patient is having a cancer or not. With that tissue sample you can get the genomic testing done. So there is no harm in going that you will the patient will get actually the treatment what is according to the genetic makeup of their cancer, and there
So
are a
that is
lot of benefits around it. So I would recommend that if the patient can afford, they should definitely go for genomic testing and get the best treatment which is available in the market right now.
Thank you, thank you, Dr. Bhatia. That was really helpful. I hope it helps clear some myths around this genomic testing, and also brings in more clarity for a patient. Thank you so much for coming to our event. It has been a pleasure hosting you.
My pleasure. Thank you, Tapsi. Thanks a lot.
Thank you. With this, we come to an end for today's event. As I had mentioned earlier, this is a weekly series, and I thank you all for taking part in this engaging session. As a part of this weekly series, next week we will be having Dr. Vijayalakshmi Deshmane, a renowned surgical oncologist, who will emphasize on the importance of early detection for breast cancer patients, and that can definitely improve the survival and quality of life for these patients. We hope to see you next week. Till then, thank you, goodbye, and have a great day ahead. Thanks.